Thank you so much for joining us today for the official launch of our Cherished Futures 2022-2023 cohort. We are thrilled just to share this time.
I thank you all, as I noted on the pad, as a Black father, for the work that you're doing. There's no more important work than trying to make a difference in this arena.
You have a major role to play in our effort to eradicate the inequality in birth outcomes between Black women and all other women in the county, women of all other groups, including white women.
We must embrace a paradigm that elevates Black persons across social, economic, religious, generational backgrounds to the platform of intuitive and intrinsic discussion.
So we know structural racism over generations has perpetuated, racial segregation, and that has pushed ultimately Black and Brown people into under-resourced, over-policed, environmentally toxic neighborhoods. So even when, Black folks have higher income levels, there's still a significant exposure to racism and a level of hypervigilance to protect ourselves and to protect our loved ones.
Part of the institutional racism is when we're talking about power, we're talking about privilege, that institutional racism gives permission for white privilege to exist. So that means that who's writing the policies, who's really putting together the priority of practices that we have. So part of the dismantling is understanding who's at the table.
We also hold different types of power. And so we want to raise up that sharing power means that we have to let go of hierarchies. And often in medicine, especially with the patient-provider dynamic, there are strong hierarchies that are reinforced. And much of this work deals with unlearning that and dismantling that.
We did some focus groups of Black moms that are prior preterm birth. What came out of the study was that Black women felt traumatized by their birth experience, especially those who had a preterm birth. They didn't know why they had a preterm birth, what they could do to prevent it if they had a baby again. And this trauma was long lasting.
Throughout my 20 plus years working in the Black Infant Health Program, I have been frequently asked about the harm Black women experience when a provider doesn't work from a place of cultural awareness and humility. I want to pose to the medical community in our midst today, are you the ones? Are you the ones Black families have been looking for to be their partner in caring for their health? As a health community, we must act to do something that has not been done before. Birthing people are looking for medical spaces that are glad to have us, listen attentively to us, and deliver to us the birth experience of our choosing. That's it, that's all. So Cherished Futures teams, it's time to take action against birth disparities.